Thank you for viewing Module 1 of our Policy Surveillance Training video series. In this video, you will receive an introduction to the policy surveillance methodology, and you will learn more about legal mapping generally. By the end of this video, you should be able to define policy surveillance, provide an overview of the policy surveillance process, explain the importance of policy surveillance, and finally define legal mapping. Policy surveillance is the systematic scientific collection and analysis of laws of public health significance. It tracks public health laws and policies over time and across jurisdictions. It also uses a rigorous scientific process to create data for evaluation and empirical research. What makes policy surveillance a scientific approach to collecting and analyzing laws? First, it uses a systematic approach, following a specific process. Second, it emphasizes transparency, because policy surveillance projects always include the raw data that was collected, as well as a description of the methodology that was used in each specific project, in the form of a research protocol. These two aspects of policy surveillance make the methodology replicable, because any individual or group can follow our process and project methodology to attempt to replicate the results of a policy surveillance project. Finally, policy surveillance has a focus on delivering a highly accurate product through quality control, in part due to the redundant research and coding that occurs throughout the process. The blocks in this wheel each represent a different step in the policy surveillance process. To learn more about any of these individual steps, please visit the corresponding modules in our learning library. A policy surveillance project begins by defining the scope of the project. This includes identifying the audience, the goals of the project, and any key research questions that the project is seeking to answer. Next, the project team will conduct background research, exploring the legal landscape for the project's topic and identifying specific legal variables that can be measured through the 5 state memos. Now, the team is ready to develop coding questions. The information used in the background research stage is used to create a draft of questions, which are then sent to a content expert for feedback before questions are finalized. The fourth step is to collect the laws and policies that will be used to answer the questions that the team has just developed. After collecting the law, the team codes the law, meaning that they use the laws and policies that have been collected to answer the project's coding questions. This step can be done using multiple tools, such as Excel, Access, or the Workbench. Note that the process of collecting and coding the law is done iteratively, meaning that batches of jurisdictions are researched and coded entirely before moving on to the next batch of jurisdictions. This improves accuracy, because changes to the dataset's scope, coding conventions, and improved search terms can increase the accuracy of future batches in the project. Once the data has been created, it is ready to be published or disseminated to websites such as lawatlas.org. This process makes it easy to track and update laws in a project moving forward in time. You will notice that quality control is at the center of this wheel because it pervades throughout the entire process. Conducting background research, collecting the law, and coding the law are all done redundantly. In addition, other quality control measures are taken throughout the life of the project to ensure accuracy. The policy surveillance process and its end result, legal mapping data, play an important role in improving population health. Policy surveillance is important because it creates data suitable for use in rigorous evaluation studies. The rigorously produced data supports more nuanced analysis and evaluation than simple observation of whether a law on a certain topic exists or not. In addition, the greater availability of reliable data will lower the cost and could potentially speed evaluation of important policies. Policy surveillance also supports the diffusion of innovation. Jurisdictions seeking to address a particular public health issue may use surveillance data to learn what others are doing. It also addresses the chronic lack of readily accessible, nonpartisan information about status and trends in legislation and policy. Policy surveillance allows stakeholders to track progress. Policymakers can see what elements of laws have the most movement in other states. Advocacy groups can track the progress of campaigns and efforts to change laws and determine where to focus efforts and resources. Social scientists can access scientifically sound data that can be used to evaluate the health influences of the laws. Finally, policy surveillance supports the opportunity to build policy capacity in the public health workforce and supports its exercise. Policymakers and other staff can learn to track their own laws, and finally, the public can have easier access to the key health laws in the community. Legal mapping is a set of techniques for capturing important features of laws and policies, and for identifying how they vary across jurisdictions or institutions and over time. Legal mapping takes many forms. It can be conducted using transparent scientific methods for empirical legal research in legal epidemiology, or it can rely on conventional legal research methods to answer important questions in public health law practice. Legal mapping is a broad expression for a process that assesses and captures features of laws and policies. There are multiple ways to perform legal mapping, each with different disadvantages and advantages. See the next slide for more detail. Policy surveillance is one form of legal mapping. If you're unsure about which legal mapping model is right for you, please don't hesitate to reach out to the Policy Surveillance Program at lawatlas@temple.edu, and we can discuss your project with you in more detail. Legal epidemiology includes two forms of legal mapping: policy surveillance and legal assessments. Policy surveillance produces robust data using a rigorous scientific process. It tracks laws over time and across multiple jurisdictions, and requires a team of at least 3 researchers in order to be completed because of the rigorous quality control measures that are implemented. Legal assessments are identical to policy surveillance projects, except that they track laws at one specific point in time instead of over time. Public health law practice includes 2 forms of legal mapping as well: legal scans and legal profiles. Legal scans are a quick scan of a topic or domain across multiple jurisdictions at one specific point in time. They can be completed by one researcher. Legal profiles are identical to legal scans, except that they track laws in one specific jurisdiction instead of across multiple jurisdictions. To learn more about conducting policy surveillance, please visit the Learning Library at lawatlas.org to access additional modules and resources, including Module 2, Conducting Background Research and Defining the Scope. Thank you for watching.